Hello and welcome to the Texas Mind Exchange. My name is Cody Gould and I'll be your host. Today we were welcomed by Alice Jewell of the McKenna Foundation. We spoke about the origins of the McKenna Foundation, advice that she has specifically for nonprofits within the grant space, as well as covered the three main topics that the McKenna Foundation is now focusing on this year, which are housing, behavioral health, and early childhood, ages 0 to 5. So without further ado, welcome to the Texas Mind Exchange. Alice, thank you for joining us.
Thanks for having me.
We're so excited to talk. We specifically, you and I, have been working on and off together for, I guess, closing in on a year now, as a member of our advisory board at the Translational Health Research Center, helping us create initiatives that help our community and giving perspective from a funder's perspective of kind of what to expect, what the need is in our community. Where I would like to start is understanding a little bit more background about the McKenna Foundation. For those that might not know, like where it's located, what you focus on, things along those lines, and then we can kind of go from there.
Okay, great. I think to talk about our history definitely is a lead up to where we're at today.
Great.
So the McKenna organization has actually been in New Braunfels for over 70 years. We started way back in the 50s with a man named Howard McKenna. He, at the time, was New Braunfels' largest employer. And he was concerned that his employees, he owned the textile mill there, and he was concerned that his employees didn't have a place to seek acute medical care. They had some physicians, but there was no hospital institution, if you will. So he set out to change that. I'm going to describe a path that he took to establish New Braunfels' first hospital, and is actually very similar to a path that we continue to follow today. So Mr. McKenna recognized a need in the community. He rallied other community volunteers, stakeholders, people of influence around that need, so created the buy-in and created a community group that agreed with him and who wanted to work on behalf of the same cause. So he got a group of community individuals together, and they set out on a path, and they started to try to figure out, what do we need to make a hospital in New Braunfels happen? And like any good project, you need land and you need money. So the group did that. They had a little bit of a challenge in finding that land until the city of New Braunfels did donate them a piece of property on Union Street. They then needed some money to build on that land, and so they did seek out some grant funding. It was called a Hill-Burton grant at the time. It was just over $200,000, and he raised the remainder from the community. I think some from his employees and some other from some community stakeholders. So in 1953, New Braunfels' first hospital opened its doors.
Oh, wow.
And so that was exciting and, really a critical moment for the community. So the hospital operated with Mr. McKenna on the board until it was renamed after him in the 70s. And that hospital operated as a nonprofit hospital entity governed by a volunteer board of directors until 2006. The board at the time decided, New Braunfels is situated in between two significant urban markets, right? San Antonio and Austin. And I think at the time, I wasn't directly involved, but they had a lot of large health corporations kind of really wanting to get into the New Braunfels market share, but they were hesitating to do that because McKenna had been in the community for over 50 years. So they said, look, let's make the decision to sell the asset at the top of our game, because at that time it was the flagship, it was a hospital, and it had expanded to some ancillary businesses, home health agency, physical therapy, you name it. So they had some other businesses to sell as well. So they did that, and they sold to Christus Santa Rosa Health System out of Dallas. And the asset from that sale converted into the McKenna Foundation. So this is technically, that transaction is something that's actually happened across the country with the sale of nonprofit hospitals. What happens to the asset? Well, the asset can turn into a grant-making foundation. So that's what we did. We're called a health conversion foundation.
Oh, interesting.
So we were formally sold in 2008, and that's when the philanthropy and foundation journey, really began for us.
Interesting. In 2008. And obviously 2008 was a very
yes,
interesting time.
It was. And so, but there was a lot of wisdom with the McKenna organization at the time. So there was a large transfer of money. And they were very well advised by some people who know about that kind of thing. You know what? Let's not put all the money in the market at once. So there was somewhat of a kind of sequenced, phased-in approach, which we realize now in hindsight, considering the market conditions in 2008, that was a good thing. So we were actually able to avoid the large sum of money being invested and then taking the hit because of that kind of forecasting.
Oh,
so
interesting. Very cool. Yeah, I guess that's obviously with the sustainability of the nonprofit.
Yes.
Huge move there.
Yes.
Sounds great.
So we invested it over time, we'll let that pass. Eventually all the money gets invested in the stock market. We also did retain a piece of real estate in 2008 that is still our home today in downtown New Braunfels. So we actually, it's what was the very first HEB in New Braunfels, downtown on San Antonio Street. So we are home not just to the McKenna Foundation, but we also own and operate the McKenna Children's Museum and the McKenna Event Center. So we are technically an operating public charity, if you will. And we can get into all the IRS, details, but that's kind of boring. So, so we operate that whole building for the benefit of the community.
Very cool. And okay, I love that we're talking about the community now because I think that
let's talk about it.
It's a great transition. Thank you for the background. I think it's hugely important for listeners and myself to understand where the McKenna Foundation came from, as well as in some of my notes I have down here. And when we think about an organization giving back to the community, which is what your whole message is.
Yes.
What exactly does that mean? And potentially, what is the goal of the long-term goal of the McKenna Foundation?
Well, in order to give back and make an impact, you have to first decide, or determine what is it that the community needs for us to do. We could sit back and just say, oh, this and this, and we want to fund that, which sometimes happens in philanthropy, particularly with family foundations. They have pet projects or they have things that they're particularly interested in. Maybe life experiences led it that way, or maybe just personal preferences, but we do not have an agenda. So we allow the community to set our agenda. So we figured out very early on, there was some questions in the community from different people, like, how are you going to use the money? Who's going to make the decision? And we thought those were really legitimate questions, really, really viable. So we decided at that time to become students of the community, doing a lot more listening than we did talking. And that was a decision that we made in 2008, and that is the primary role that we still serve today. And that is to be students of the community, constantly learning, asking questions, because as you can imagine, since then, the New Braunfels community, New Braunfels and Comal County has, it's grown quite a bit. And we've had some benefits to that growth, but we've also experienced some real challenges. So we have, looking back, it's easy to know, but at the time, we didn't know. There had never been an asset-based institution of philanthropy serving New Braunfels and Comal County before we were the first one. So instead of just coming out and starting to write checks for issues that may have been a big issue, a small issue, not an issue at all, we decided to let the community help us decide where to invest our money for the biggest impact.
Yeah, that taking the need from the community as the center point is obviously seems to be the way to go. I would like to talk about that a little bit more. When you're looking at identifying community need, what does that, like, is it community conversations?
Mm-hmm.
Is it needs assessment?
Right.
What does that look like?
Well, I wish there was one answer,
Okay.
but it's much more complicated than that.
That's great. Let's get into it.
So I think how we first decided to kind of start getting that feedback was, we didn't call it this at the time, but we had this building and people knew we had the potential to have this funding. And when, we used that to our advantage. So we said, hey, we're the McKenna Foundation and we're looking to make some investments. We want to know what you think. We want to know, what challenges your nonprofit is facing, and what, more importantly, what challenges are the people that you are attempting to serve? What are they facing? We want you to come together. We're inviting you to this meeting. And so typically we've learned now when a funder invites people, they usually show up, which is great. We don't use that to our advantage, but we do. So we started to convene. And we started to ask questions. Early on in 2008, some of our nonprofit friends were really feeling the effects of the downturn in the economy. People had kind of retracted. They were holding their cash a little bit tighter. So some of our nonprofits were a little bit cash strapped because their donations were down. And that gave us a good opportunity to engage them in some real conversations about, what are your needs? What are you not able to do because of a lack of cash, a lack of funding, an increase in demand? What is it that you want to do that you're not able to do? So having those conversations is key. And then when you assemble groups, and if you're a good listener and somewhat decent at aggregating information, trends start to emerge. Right. And trends definitely started to emerge back in the late, 2000s in New Braunfels. Since then, we have consistently been on the list of top 5 fastest growing communities in the country. And what we were hearing was that what I will call now the social services infrastructure in New Braunfels and Comal County was seriously underdeveloped for our growing population. And, what that means in, easier terms is we were missing some really key functions and services, like our hunger gap was wider than was acceptable. We had no services for people experiencing or on the verge of homelessness. We had no, and continue to still to this day, have no public transportation system. We had a very underdeveloped physical and mental health accessible services orientation. So you see where I'm going. So very basic needs for people experiencing, low or fixed income. They did not have a resource. And despite us having I don't want to call it robust, but a presence of nonprofits wanting to fill that need, we just didn't have the infrastructure in place to be able to do it. So, call it following Maslow's hierarchy, call it, just human existence. What do I need the most? We kind of started just to follow down that path and to start tackling some of, kind of these basic, what do you need to survive? What does a person need to, getting up in the morning to make it through the day? Most basically, what do people need? And unfortunately, we started tackling some of those issues early on, and some of those are still, some of the same issues that we're tackling today. We've made progress in a lot of ways, but we're still not done. And I think that is a testament to the fact that we have so many more people in our region seeking, demanding the services or needing help with that. So we've grown, but we have not been able to, keep pace with that growth in the social services sector.
Yeah, that makes sense. I mean, there's a lot to tackle.
Yeah.
If people can't get to and from work or whatever that might look like.
Transportation is critical.
I mean, it's huge. It has ripple effects across everything.
Right.
And I would love to transition that a little bit more towards mental health specifically. Yes. And when we talk about like these foundational needs and food, I'm sure food, housing,
right,
and physical and mental wellness, your McKenna Foundation as a whole has such a broad focus.
We do, yes.
And it also seems like there's a little bit more focus going towards mental health. And when did you see that trend starting to appear?
So you were spot on. We were looking at hunger. We were looking at housing. And because we were just continuing to listen, mental health and people in crisis was just something we just kept hearing. And, I'm like, okay, I get it. Let's do something about this. We did not feel equipped with the right information, however, to start making grants, because we want to make sure that we are making investments that not only are going to make an impact, but that are that are sound, that are going to be hopefully make an impact in the moment and be sustained after the fact. So, and we wanted to really start with what does the community need the most. So, it was also triggered by in 2014 we had experienced 9 suicides of students in one of our local school districts, which is absolutely unacceptable. That's alarming. One suicide is too many. So, I think we were kind of crescendoing to this time where it's like, okay, let's really formalize an approach to addressing community mental health. At that time, just like we kind of followed the model that we always follow, which is when we don't know what to do, we turn to our community partners. And that's nonprofits, but it's also, we convened what we called at the time the McKenna Mental Health Task Force. Really creative. But we called on our nonprofit partners for help. We also knew even at the time that mental health is an area that is influenced by way more than just nonprofits. So we engaged law enforcement, we engaged our school districts, we engaged first responders, community stakeholders, some churches, kind of anybody who we felt like was somewhat in the mental health space to kind of decide like, okay, guys, let's come together and what do we need to do? So we did that. And at our first meeting, we did bring in, an outside facilitator just to kind of, help the conversation move along. And what we realized was alarming. We realized people who were just down the street from each other, they didn't know each other. They maybe had heard of them, but they didn't have a contact there, and they certainly weren't working together. So we had to back up. Right. And we were able to do kind of a community scan of needs and figure out like a gap kind of analysis. And that was not, we were going to kind of launch into the brainstorming and goal setting phase, but we backed up and decided, hey, let's just get to know each other first. So we did that. And that in itself is a success. Just getting people together. I know it sounds so simple, but getting people together to meet each other and be like, see how their services probably at the time could overlap but don't. And if we should, and we should do that. And if we could do that, that's going to make an even better, result for our community. So we did that. That was great. And we realized we had gaps in just about every way that you could possibly think of, from, community-based counseling to, crisis response to, mental health in the schools, jails, you name it. So with that, I was hoping, we're going to use some deliverable to come out of this group to like make grants with. That would be great. So 5, 6 goals that we can really focus on. Well, we decided on no less than 23 community goals. But I was involved in all that, and there wasn't one that I would have cut out. I mean, there were 23 really legitimate goals, ranging everything from crisis to, care for seniors. And so we did that, developed the document, but then, straight away we said, okay, great. Here's the goal document. What are we going to do about it? So we pretty quickly asked the stakeholders to prioritize what do we need the most. And from that came the development of a community education and awareness campaign, because at the time, or 2015-ish, the stigma against, seeking mental health care was a lot was a lot more profound than it is today. I think we've made a lot of ground in 10 years, but at the time it was like, counseling, are you crazy? Like, my kid doesn't need that, or I don't need that. Like, we were combating that, as you are aware. So we needed, something to not only reduce the stigma and, work on educating people that it's okay to seek help. You're not crazy. No, this is just like seeking help for a broken arm. If you're feeling unwell mentally, let's talk about it. And at the same time, educating the community about the resources that we do have. So kind of a double-edged thing. And we did develop a marketing campaign that is still in existence today called the Mental Advocacy Partnership. mapcomal.org is where you can still find that resource. And it's all targeted toward mental health resources in New Braunfels and Comal County. Everything from crisis to substance misuse to, domestic violence, or any situation that could lead to a person becoming mentally unwell. So we wanted to make sure and have something for that. And then the second arm of that came pretty fast, which was, we needed a way to respond to people in crisis 24 hours a day, 7 days a week. Because prior to this, our only response was through our police department or our sheriff's deputies, and they are great men and women who care about people, but they are not qualified mental health professionals, and everybody has a different approach to their job. And so we had some that were, really had done a lot of mental health training and knew what to do, whereas some, were not quite there. So we knew we needed to do some work. So we worked through our local mental health authority, which is Hill Country MHTD, to develop our mobile crisis outreach team, which is a team inset in the mental health authority that responds to people experiencing crisis anywhere, any time of day.
Wow.
Mm-hmm. And that program, fortunately, continues today.
Yeah, when did that start? 2015?
So we would have made our first grant for that in 2016. Mm-hmm.
Wow, almost 10 years.
Mm-hmm.
That's a lot.
Yes.
I mean, it's at its core, you're meeting the community where it's at,
yes.
which is what you're initially talking about.
Right.
I'd like to go back briefly to something that caught my ear.
Mm-hmm.
Allowing people to get to know each other.
Yes.
Being the crux of, kind of breaking some of the stigma, enhancing connection about the
right.
community. I'm sure New Braunfels started as a very small community.
Mm-hmm.
And as it's been one of the top 5 more growing communities in the United States, that has spun up very quickly and people are disconnected. Are you still kind of focusing on connecting people organically, or are you more focused on, I guess, a policy and like a granting end of things?
Mm-hmm. Connecting with each other is a daily task. We want to do that in our personal lives, and I certainly would suggest to anybody in the social space that we continue to be aggressive on bringing people together. As soon as we get siloed and don't, communicate across organizations, across, any kind of line, our impact is going to be lessened. So yes, we continue to convene. We actually reconvened that same group around kind of a revamp of our goals 10 years later. We did that last fall. And we have renamed that group the Behavioral Health Leadership Team. And it's evolved. People change in their roles. People move. They come. They go. Organizations have been added. I think more and more people have become aware that mental health is their responsibility. Mental health is a responsibility of every person. Mm-hmm. Whether I'm asking you if you're okay, or, I'm a clinician who sees patients, on a regular basis. Like, we all have a role to play in the mental health space. And so we have expanded that team to be, to include people from, any kind of background and any kind of opportunity to affect the change. So not only do we do that, that has become potentially the McKenna Foundation's most important role in the community is actually convening people around issue areas. So we do that in the mental health space. We have also continued to do that with our Comal County Homeless Coalition. We do that with our local nonprofit EDs. We even have a group for our fundraising professionals. I mean, we because we have the McKenna Event Center, which is a space that we rent exclusively to nonprofits, churches, government, civic groups, schools. We have the space for people to meet. And sometimes people are just lacking a place to meet. Like they want to get together, they have something to talk about, but where do we go? Well, we eliminate that barrier for people. So you just come on in here. Have a professional, dignified conversation with your colleagues. It's important, in our space here. And it really has actually, I think, become part of our community identity is bringing people together.
That's amazing. Yeah, I think that's such a potentially overlooked solution, short-term solution and long-term solution mixed, of both organizations that have space and that have a duty to connect people. Because, and this is kind of, how would I say this? Providing a check is sometimes easier than doing the legwork of bringing people together.
Yes, absolutely. Yes.
And I think that's, especially when time is of the essence, it's sometimes it's like, who's doing a great job at this? Let's make sure we continue to fund it and doing that.
Well, and we've never just been a check writer. I mean, we make investments in community well-being. So we will take all the time that we need. We will have all the conversations that we need to make sure that not only is it the correct recipient organization, but do you have the other resources that you may need in addition to the funding? Do you have the right partners at the table? Are you talking with the school district? Have you told the police department what you're doing? I mean, we want to make sure in every way possible. We don't want to meddle or get into their business, but to the extent that we can bring every single necessary resource to the table as a funder, using that advantage that we have, the kind of just the power of advocacy and leadership, bringing that to a grant, bringing that to a project, bringing that to couple with our funding is just, going to make a better result in the end.
Absolutely. And I love that you started talking about that because it's a perfect little transition into like grants and the veil that is sort of over funders in philanthropy in general. With our center, we commonly work with community members that are looking to get grants or organizations that are applying for grants. Someone on the other end of the spectrum as those that are usually writing the checks or kind of partnering with some of these organizations to make, I guess, civic and community impact. What are some misconceptions or what are some kind of like things you want to potentially provide some perspective on?
Well, the first thing that comes to mind is this idea that a grant is a grant is a grant. And a grant writer that can write a grant to one potential organization is the same skill set as one that can write to another. And that's not true. Grant funding can mean a lot of different things depending on the person or entity that you're writing to. And the simplest way to kind of break that down, the largest grant funder, in the country is our government. People writing for federal and state grants is a beast of its own. I mean, that's a skill set. You could be, busy for, your life if you know the intricacies of how to really navigate the complexities of a federal or state grant. Because, typically they're going to ask for more information, more detail. Those grants are always, typically reimbursable. There's just a lot of nuances when it comes to grant funding, which I hope government grant funding continues because, it really is, helping to save people's lives. So we've got government funding. And then there's a lot of different kind of other funders. You've got United Ways, which are typically driven by volunteer review teams. You've got family foundations that now we're seeing kind of a proliferation of more and more as the transfer of wealth from one generation to another happens. You might have a generation that was very successful, established a foundation. Typically, they like to keep it in the family, or at least mostly so. And so then the next generations, maybe the grandparents establish the wealth, but then the children and the grandchildren kind of become the decision makers. So a lot of times, those can be beholden to the original generation that generated the wealth, but not always. So, as family foundations evolve and generations change, funding priorities, change for family foundations. And those are certainly growing in number across the country. We've got community foundations that are holders of donor advised funds. We've got just lots of different things. So I would consider, and most, I'll just say this too, most pockets of wealth, or most opportunities, to provide for grant funding, that was generated or derived by an individual or business that has some kind of philanthropic bent. They want to do a particular thing. They want to fund, environmental conservation or the arts, or, this is totally not backed up by research, but from what I've seen, the social services is not, other than, maybe kids, being a, pretty popular recipient, and animals too, but, it's not always very popular when it comes to foundation grant funding. So, understanding how hard it is to fundraise as a nonprofit, be it higher education or, serving, homeless, single moms and their kids. Everybody's looking for grants. We have one hard and fast rule at the McKenna Foundation, and that is that we help residents of New Braunfels and Comal County. But my other informal guide is we are here to fund things that are traditionally very hard to fundraise for. Because we recognize that so many other grant opportunities are very targeted. We only do capital. We don't do capital. We do the environment. We do housing. I wish more people did housing. They're just very specific. So very few things are like, you know what? Hey, tell me what it is that you're working on to benefit the community, and what do you need the money for the most? And that willingness to be a partner and letting that power dynamic be equal. A lot of times the people with the money seem to have the power. I see it very differently. If my money at our money here at the McKenna Foundation means nothing if I can't give it to somebody that's going to turn it into an impact on people's lives. So I've kind of transitioned from a grant to, foundation funding. Finding the fit of the funder is really the science of it. Making sure that you're connecting with a funder that is really looking to fund you for what it is that you need. I see a lot of, funding comes first and then the program, and we like to look at it the other way. Like, you tell me what you want to do, and then we'll find the funding. The funding doesn't lead the program leads the funding. So, being able to go back to what we were talking about earlier, to be nimble, really listen, and fund in a way through grants that is you're uniquely positioned to be able to do, is something that I think it goes in a little bit deeper into grant funding than you might see on the surface. But there are people that actually look at it that way. Yeah.
I'm happy that we kind of opened up that conversation, because I've the more I'm getting involved with working with nonprofits, especially now with some funds going away, or people tightening up their wallets, or organizations tightening up their wallets, it is an interesting, and kind of people feel, I don't mean to speak for everybody on this, but I do feel like there is a sense of, where will the money dry up?
Right.
Which leads me to ask, what do you personally think about the future of like kind of grant funding
Oh, yeah.
and nonprofit?
Well, sadly as it is, we tell our friends, our nonprofit friends and partners that, grant funding is the least reliable funding that there is. We have, there isn't a school for this, but if there was, I would have gone to it. The ability for nonprofits to generate their own revenue, program generated revenue, either through fees or memberships or, contractual obligations with another, partner. Some of our nonprofit friends do have business enterprises, thrift stores, or, related, program related, revenue generation that, can help you have a little more control over, your revenue, right? It's not funds raised, it is funds earned. And we want to help people to the extent that they can realize as much generated revenue as they possibly can, because that is money that they can earn. That is money that they have absolute, control over. It's unrestricted. They can use it for whatever they want. And we'd like to think it could be, increased, over time by, figuring out developments in the business model. That's not the case for everybody. Not everybody is in a position to be able to ask their clients for, a portion of the value of the services that they received. That's just not always the case. And not all of them have an ability to, throw up a thrift store and manage all that. So we do advocate for generation of their own revenue. Then in this region of the country, we are experiencing an increase in the population and the number of businesses that are popping up everywhere you turn. The number of potential individual and business donors is growing by the day. In theory, it's infinite, right? Telling your story, getting the narrative out there to talk to the public about what it is that you are doing to serve the community, being compelling enough to turn private dollars into charitable dollars is a huge opportunity. It's hard. It's the hardest way to raise money, no doubt, because it's sometimes one individual at a time, or it's one event sponsorship at a time. I mean, it's tedious. It's hard. And so I say that knowing it's not an easy answer, but it is the truth that we've got more people and businesses to give than we've got of anything. So working on donor cultivation, donor prospecting, donor cultivation, and then at the same time telling your story. Like if you can't effectively tell your story and compel somebody to take some, money out of their bank account and send it over to yours, I mean, you can find the perfect donor, but if you can't convince them to give through your, compelling narrative, then, the battle is lost. So that's really making sure that people are spending an appropriate amount of time for the opportunity that individuals and businesses present is really important. And then, like kind of when I was talking about the grant funding, grant funders are getting more and more specific. They're getting more and more niche. They're getting pretty tedious, sometimes in the terms of data. Sometimes it's what are they looking to get back in return. Sometimes the grant application and the potential award is not worth it, considering everything that you're going to have to do, maybe administratively, just to fulfill the obligations of the grant. So I don't think that the grant funding world in general is getting any easier to navigate, to receive funding, or to fulfill funding around. Now, that's maybe not a pleasant picture on the nonprofit funding, outlook, but it's realistic because the work that everybody is doing, they're saving people's lives every day.
Yeah.
So it's worth the effort.
Yeah. Yeah. I liked what you said about the storytelling aspect of it, because that led nicely into the question that I had next, which was, how do people and organizations stand out? Because there are a lot of organizations doing similar things. And does it look like collaboration? Does it look like again, more of just focusing on that storytelling? Does it look like impact? What would you say?
Right. Yeah, I mean, there is so much competition for people's attention. And, we fall in the social media feed just like nonprofits fall into that, just like, Target and your church and, everything else. I think having an effective narrative, being very concise about what community need it is that you are looking to fulfill is paramount. Continuing to yell that from the mountaintop every single day, just like convening and connection is an everyday task, so is awareness and telling our story also an everyday task. We've done some work in the space of people experiencing homelessness, which is a polarizing issue. You kind of have feelings about that. Some people have really strong feelings, some people have none. And so the concern is, how do you turn the tide, or how do you convince a community that serving people who are homeless is a good thing to do? And I learned after years of trying that, you don't have to. You don't have to convince the whole community that what you're doing is important. You don't have to convince the whole community that serving the people that you're trying to serve, they're worth it. They mean something. They're worth the effort. That's all true, but you don't have to convince everybody. You just have to convince the right number of people in a significant way that can turn around and send some resources your way. So to think that, we would need to it's an insurmountable task to think I've got to reach the community of New Braunfels or the community of San Marcos. I've got to reach the whole community with my message. No, you don't. You just need to convince the right people who are already inclined in their heart and mind to believe you and to feel you and to want to return some resources back in your direction. So you don't need everybody. You don't need the whole community. You need who you need to continue to perpetuate your mission. And having that, I think, is it makes it seem doable. It makes it seem, like maybe you're, setting realistic goals just like you would in life, right? Like I'm gonna, try to, depending on the scale of your organization, I'm gonna try to reach, 10 new people today, or 10 new people this week, or whatever the case may be. But understanding that, salesmanship, a lot of times that is what it is. You don't need everybody to be your customer. You just need the right amount of people to buy your product that can, make the business, make the nonprofit be able to fill its mission.
You're the first person that I've interacted with that's been so open about like bringing a sales mindset into nonprofit. And I think it's really important to be able to talk about, because no matter what our what the benefit is to society that we're bringing, we still have to convince others to believe in the initiative that we're doing. That's really an important message, I think, for a lot of people to see, because there is that groundwork of awareness, and awareness is sales.
Yes.
And that's fascinating, because I think a lot of people don't really make that connection. Which is understandable.
Well, and
hard.
sometimes it's just like, just like in goods and services. I mean, sometimes it's not always the best product that gets purchased. Sometimes it's whatever has the best packaging or is clever or whatever just, hammers you with the most, Instagram ads or whatever the case may be. I mean, it's, I don't mean to diminish the work that we're doing on behalf of people by talking about it like that, because that's not what I'm doing. But when we are trying to attract new donors, when we're trying to attract a bigger army into, helping us to fight the battle of, that is fulfilling our mission, I do think that you have to use whatever strategy is going to work.
And maybe, does the same go for a nonprofit that's looking for donations or that's looking from a grant from you all, in regards to like really putting themselves out there, showing what they're doing for the community, kind kind of really being open to sharing their story and their narrative. Does that have any impact on?
Yeah, we're not distracted by sparkly packaging. What we, for really for our first 16 years of grant making, we made grants really in fulfillment of our mission, which is to advance the well-being of the New Braunfels community. And with that, well-being is a very broad term. At the beginning, I was like, oh, that's not really very targeted. But now I'm like, oh my God, I'm so glad it wasn't that targeted, because it's really allowed us to learn. It's really, it's nice to have a broad umbrella under which we can really classify community need as, being as broad as it actually is. So we funded that way, over $30 million in that 16 years of just kind of things. We would prioritize things that were bigger needs, but we really were able to really fund in a lot of different issue areas in the community. We have since, though, to get to your question, reshaped our grant making this year to prioritize what we would consider to be the 3 biggest gap areas of need in New Braunfels and Kalmar County, in which we are currently telling our residents, no, I can't help you with that, and changing that no into a yes. And the only way we're going to be able to go from no to yes is if we very intentionally target funding and investments in that area for growth. We're doing okay sustaining, but if only in 10 years, the only way we're going to look back and be in a better spot than we're at today is if we intentionally say we're going to invest in that and we're going to do more, we're going to do better, and we're going to progress. And those 3 issue areas in which there are just a dearth of infrastructure is housing, mental and behavioral health, and early childhood, i.e. kids between the ages of 0 and 5. So we've taken we did a lot of work with our board over the past year and a half and the community to really discern out, is this something, do we want to prioritize our funding? I don't want to say restrict it, but what do we really want to prioritize investment in areas of higher need? And I think, we ultimately came up with the idea of yes, because in our community, if the McKenna Foundation doesn't lead on it, if we don't lead in those 3 areas, we will look back in 10 years and it will be in the same position. So this year we decided to take a little bit of a pause. And it wasn't a formal request by the community, but based on everything that we've heard that they cannot fulfill people's needs in these areas, we have said we're going to intentionally fund in those 3 areas in 2025, and we're going to delay funding in some of these, other areas that are able to find more resources or better funded, or is don't rise to the level of community need as some of these other things. So going back to, the way Mr. McKenna did it from the very beginning, we let the community's needs drive our decisions. Yes, then you do come in, and then it's a conversation. What do you want to do, nonprofit, that you serve your population in these ways that you're not able to do now? Talk to us about your program plan. Talk to us about how it's supported by, best practices, or how that's supported by, research or, other data that you found. Talk to us about partners that you've already recruited into that program design. Talk to us about, other funding that maybe you might have identified that you were able to bring, to a grant, to a project. How, is this progress made, or is this a piece of the puzzle to come, or is there another step to this where we're going to have even greater impact, but this is a pilot program and we want to get to here. So the salesmanship to us when it comes to grant making is really about the soundness of how well developed your program plan or your project plan is to fulfilling a need in the community that is not being filled right now.
Amazing.
So how are you? What are you bringing to the table in addition to our funding. I mean, and we'll help you. Like sometimes we'll know people and be like, oh my God, this is great. You need to talk to this person. Let's continue to assemble the best program plan that we possibly can with the funding that's there, with the partners that are there to fulfill a community need that was not being filled before. And then the McKenna funding can come in and say, you know what, we're going to fund in this way because this is, if it's a building project, we fund engineering studies, land, all the things that nobody wants to fund. People don't want to fund, admin and leadership, but sometimes you just need to. And so how can we come in and be uniquely helpful as a funder in order to get this really sound project design off the ground to fill the community need? So I think the completeness, thinking about, how can we be creative? How can we think of fulfilling needs in ways that we've never thought of before? Who can we recruit to the table? All those things that can really strengthen a grant application. That's the salesmanship to us. But, we're willing to be part of the process too.
Amazing. Mm-hmm. The need is a theme that I heard you talk about.
Yes.
As well as the grant application. Mm-hmm. And I'm sure a question people might be thinking of is, what is the role of data in the grant application?
Yes.
If you throw in too much data, is it overwhelming? Or what does that look like for you all?
Data it's a very popular word in grant making. And I have colleagues who are like, oh, I'm so data driven. And that's great. I mean, data is part of it. I wouldn't say we are data driven. We listen to data and we look at data, but we know it's only part of the puzzle. It's just important to me to sit across from you, clinician, practitioner, caseworker, social worker, therapist, for you to tell me what your people are experiencing. What do they need and ask you for that you can't give them, you can't help them with? That the aggregate of all of those conversations that we have with people who are doing the work, whether you're a police officer, a therapist, whoever, that is in our world just as important as data. Because the data, it's the numbers. It tells you what happened. It's not telling you what's happening now. It's not telling you what didn't happen. So some of the conversations that we're having now is about funding prevention work. And funding prevention work is not popular because how do you report data on something that you prevented? So data in prevention work means nothing. I mean, it doesn't exist. But sometimes, we'll take mental health. When we are caring for an individual who is experiencing a mental health crisis, they are at the top of the mountain and they are not well. They're, not able to function. They need all kinds of resources thrown at them. That person, to care for them, it's very expensive. It's very resource intensive. It's expensive. They need the most resources, right? What would happen? We know we need to take care of people, but what would happen if we invested in a group of people that were halfway up the mountain or just starting their way up the mountain, right? People who have yet to reach that level of crisis, whose issues and needs can be met, whose the problems can be mitigated before they've gotten to be their worst. Not only does it take fewer resources, it takes less time. It takes so much mental strife out of that person's life. I don't want them to experience the trek up the mountain to mental health crisis, but thinking about how can we keep people from traversing that hill in the first place is something that we are really exploring, not just because, your funding can go further and impact more people because I don't think it's not as resource intensive, but also isn't the goal for people to not experience the mental unwellness in the first place? Mm-hmm. Like we want intervention and we want recovery and healing. But I don't want them to have to get to that point. Who's worrying about that? Who is worrying about people that are, and kids is why kids are a really great investment, because we shape them today and they turn into high functioning, amazing adults, versus we don't invest in them today. They develop, poor mental health habits, poor physical health whatever, and an over reliance on technology versus relationship. And then we have to correct that as adults. I would rather fix that in a kid, or not even fix it. I would rather prevent it, and teach them the healthy things so that they just seamlessly move into adulthood, high functioning and well. And that's the thing that's tricky about kids, is that sometimes you can invest in kids and you can talk about, I provided counseling for X number of youth, but you have no idea what you prevented from happening. There's no data to back that up. There's no data to say how many suicides we prevented by kids who never even got to the point of thinking that that was something, potentially a path in their life. So that's why data is fine and it's good. And a lot of times it does tell you what happened, but it doesn't tell you what's happening, and it doesn't tell you what didn't happen. So I think you just, as funders, we sometimes over rely on that, and we look at it, but we don't overly rely on it.
Totally. Yeah. I think you have to look at it to understand that there's a case to be made. In the same vein, I totally understand, and I haven't heard a funder come out and say prevention, might not have data behind it, because that's true. The point that you made about suicide prevention is an important one. Like, how many people are we stopping to getting to that point, or who might be getting to that point? And what does that initiative look like? How many people are you positively impacting? We usually look at statistics and numbers as, potentially cases for us to build initiatives around.
Right.
But what if the opposite is also true? If there's also not data there, and that data that's beneficial. Right.
And so, what are you using to tell your story?
Yeah.
And sometimes you look for trends that are rising. Sometimes you look, on the rise. Sometimes you look for on the default, but on the decline. So it probably partially, also depends on what case are you looking to make. I mean, right? No matter what case you're looking to make, there's always going to be research and data to back it up. No matter what you want to prove. So it's important, and I do think that it can help. Like the death by suicide number per year. That's something that we look at. We want that trending downward. And there is a case to be made that, if it is trending downward, that some things that you're doing in your community are working. Do you know what? Not necessarily. I mean, you can point to some things, but it's really not. It just is telling you, what happened.
This next question might be a little bit inside baseball.
Sure.
With that said, the three focus areas of housing, mental health, physical health, mental and physical health.
Behavioral health. Yes, substance misuse, yes.
And early childhood. Someone who is looking to work with the McKenna Foundation, and someone who's looking to potentially apply for a grant, what advice would you give an organization that fits within those three categories? So
we put our time where our money is. And in each of those initiative areas, we actually developed, as the staff, alongside the board and the community, really, we developed work plans around each of those initiative areas. Those are on our website. And it does outline kind of the desired future state of what we would like to see in those three initiative areas in the community. These are not there's, three objectives for each and some priorities, even some metrics of some things we could possibly look at changing in each of those initiative areas. And so these were all priorities that were informed by the community. We didn't just sit around as staff and say, what do we think, improved housing conditions for people in New Braunfels, would look like? We worked, hand in hand with, our local people who are serving people facing homelessness, homelessness prevention programs. What do we see as a community that if we had these kinds of programs, if we were able to meet these needs, that would indicate community progress. Same with the mental and behavioral health. So I told you about our leadership team. They revised their 23 community goals down to 21. And so we took those 21 goals and we shaped that into this behavioral health work plan. And so we're gonna grant fund around what the community said we needed to do to be able to better serve people's mental and behavioral health needs. So, people, now people in New Braunfels and Comal County who are looking for funding, who are in these areas, we have stated some priorities and some strategies that we believe, could be some pathways towards success and progress. But, while these work plans exist, I'm not going to pretend like that's the end all be all. You as nonprofit, you may have an idea to serve people's mental health needs that we haven't even thought of before, which is why we are encouraging, as part of our grant making framework for 2025, conversation. So if you think you have an idea, come talk to us. And while that can be time intensive, and we have had a lot of meetings, which is great, there's just so much richness in the ideas and dreams that come from nonprofits that are serving people. And a lot of times, Cody, it's so cool because nobody asks them, what's your dream? What's your goal? And nonprofits don't have the ability to dream for the most part. They are restricted on their resources, and they're constantly in almost like how do I make, 20 things work with this, one little pot of money. I mean, that they are doing the, magician's work every day. Nobody ever says, hey, if I was to give you money to do whatever you wanted to do to meet the needs of the people that you are meeting, what would you do? And we've asked that, and it takes them a minute, because they really haven't been able to give, the time and, space to even like thinking about what that would look like. But, they are the holders of, the answers for how we're going to make progress in community mental health. We've seen, a real uptick in, death by suicide in our senior population. Okay, well, let's talk about that. Is that spelled out necessarily here? No, but let's talk about what you're looking at. And so we wouldn't know that if it wasn't for the people doing the work and inviting for them to come have a conversation with us. So that's gold. Yeah.
Yeah, having that back and forth, having the openness to talk to you all, to approach you with what they're working on. Mm-hmm. That dream question is an amazing one, because I totally could understand. Nonprofits don't get asked that normally.
Nope.
That's amazing. I feel like we could talk for hours. This leads me to ask kind of like the final question for you, which is working at the McKenna Foundation for as long as you have. If you could just pinpoint one thing, or it can be a grouping of things, but maybe one thing that you are the most proud of.
Oh,
what would that be?
Gosh. There's a lot of projects that we have had the good fortune of being able to be a part of. But I would say our organization, and me specifically, I hold dear and just would give it up for absolutely nothing. The relationships and the trust that we have created with the nonprofits that are serving the community. Trust is not given, it's earned in our world. Doing what you say you're going to do, being there in times of, crisis. A lot of funders, they want to hear your celebration stories and your successes. I want to hear from you when your day is terrible, when things go awry, when a board member, totally throws you for a loop, and everything that you thought was up is now down. But I am most proud of the trusting relationship that we have developed with our nonprofit partners, as well as with some of our other community partners, with the city of New Braunfels particularly, who has really come around to be a great partner to the nonprofit community. But I'm proud of that trust that we have created. Having trusting relationships before the time of crisis hits is key. Knowing people are going to be there, anticipating their reaction, knowing that somebody can come to you with good news, bad news, whatever the case may be, but being sought out as a resource regardless of the situation. We have become that for the community. And that has helped this year because we will not be able to fund some of the people that we have funded for 15 years in a row. And I know we've got some people that for whom, the McKenna Foundation has given them $25,000 a year for the past 10 years. And how are they going to fulfill that? And they may have had some grumblings on their own, but the very real relationships that we've had is, we know that's hard. They may not necessarily like it, but they understand why we're doing it. And they understand that the reason that we're doing it is, they trust us to know that we are really here to benefit the community. So I think that those trusting relationships developed over now in our 17th year of grant making is probably what I'm most proud of, because it's been earned over time.
Yeah. Well, Alice, thank you so much for joining us. What would be the easiest way for people to reach out and continue the conversation with you? Yeah,
I'm very easy to find. We're at McKenna.org. We've got all kinds of great information on there from some of our information on our issue areas that we're focusing on, to our grant making framework, to information about the community. My contact information is there. Email, drop by, whatever the case may be. Conversations with people and meeting people it's our bread and butter. So happy to hear from anybody.
Great. Thank you so much for your time.
Thank you, Cody. Great chat.
This podcast was presented by thecentralstate.com. Thecentralstate.com is a consortium focused on improving resilience in Central Texas by using evidence from research to improve human and community health. This website highlights health and research data by county and opportunities to find funding and resources for mental health programs in our area. Additionally, there are interactive calendars that keep you up to speed regarding what is happening right here in Central Texas.